So, hello everyone. Our today's topic is the cavernous sinus. The venous sinuses, we know they are the blood-filled channels found within the dura mater, the outer membrane covering the brain and the spinal cord. So they help in draining the deoxygenating blood and CSF from the brain. So let us discuss what are the paired venous sinuses. There are 23 venous sinuses, of which 8 are paired and 7 are unpaired. So the paired venous sinuses, these are the paired venous sinuses. The important mnemonic to remember them is: can silly individual try some super powerful moves? So can silly individual try some super powerful moves? So this one is the mnemonic to remember them. And the unpaired venous sinuses, the mnemonic is: Saturn is seriously occupied and peculiarly busy. Saturn is seriously occupied and peculiarly busy. So this is way to remember the unpaired venous sinuses. Now let us start with the cavernous sinus first. Now the cavernous sinus, it is one of the paired venous sinuses. It lies in the, remember it is located on either side of the sella turcica. That is a bone that is seen at the body of the sphenoid bone in the middle cranial fossa. So what are the extent? So these are the extent of the cavernous sinus. Superiorly, there is optic tract, optic chiasma, olfactory tract, internal carotid artery, and anterior perforated substance. Inferiorly there is foramen lacerum and junction of body and greater wing of the sphenoid bone. Medially there is a hypophysis cerebri. So medially there is hypophysis cerebri. Laterally there is temporal bone of the uncus. Below laterally there is mandibular nerve. So here it is the mandibular nerve. Anteriorly there is the superior orbital fissure and apex of orbit, and posteriorly the apex of petrous temporal. So remember all these by this diagram, very beautifully given in the showing the relationship of the cavernous sinuses. Now what are the structures within the lateral wall from above downward? The mnemonic that you can easily remember is O-tome. So the structures within the lateral wall of cavernous sinus from above downwards, first is oculomotor nerve, then trochlear nerve, ophthalmic nerve, and maxillary nerve. So mnemonic is O-tome. Oculomotor nerve, trochlear nerve, ophthalmic nerve, and the maxillary nerve. So here it is. The oculomotor nerve lies in the anterior part of sinus. It divides into superior and inferior division that leaves the sinus by passing through the superior orbital fissure. The trochlear nerve, it crosses superficially to the oculomotor nerve and it enters the orbit through superior orbital fissure. The ophthalmic nerve, it divides into lacrimal, frontal, and the nasociliary nerve. The maxillary nerve, it leaves the sinus by passing through which foramen? Foramen rotundum. Now what are the structures that are present through the medial aspect of the sinus? The structures that are present are the internal carotid artery and the abducer nerve. Try to remember that. Now what are the tributaries? The easy mnemonic is O, I see squirrel scurry forth. So O is ophthalmic vein. C is I is inferior ophthalmic vein. C is the central vein of the retina. C or Uh, the next is squirrel, OIC, squirrel insect. Squirrel is superficial middle cerebral vein, insect inferior cerebral vein, scurry sphenopalatine sinuses. Fourth is frontal trunk of the middle meningeal vein. So these are the tributaries. The easy mnemonic to remember is OIC, squirrel, OIC, squirrel, insect, OIC, squirrel, insect, scurry, fourth. That is the easy mnemonic. From the orbit is the superior ophthalmic vein, inferior ophthalmic vein, and central vein of the retina. From the brain, it's the superficial middle cerebral vein, inferior cerebral vein. From the meninges is the sphenoparietal sinuses and frontal trunk. Now, what are the drainage sinuses? The drainage cavernous sinuses, they drain into the mnemonic is tiger in Paris fight. Tiger means transverse sinus. In means internal jugular vein. In Paris, P for Paris, that is pterygoid plexus of vein, and F is facial vein. So remember the important mnemonic. An easy way to remember this. So first is into the transverse sinus through the superior petrosal sinus, into internal jugular vein through the inferior petrosal sinus, and pterygoid plexus of veins through the emissary veins, and into the facial vein through the superior ophthalmic vein. So all these, remember, all these communication, they are valveless and blood can flow through them in any direction. So these communication, remember, they are valveless, allowing blood to flow in either direction. By expulsion of blood from the cavernous sinus, it is influenced by various factors. The first is expansile pulsation of internal carotid artery. The pulsation of internal carotid artery within cavernous sinus contributes to movement and expulsion of blood from the sinuses. Second, gravity. Gravity play a role in drainage of blood from the cavernous sinus, facilitating its movement toward the venous drainage pathway. Third, the position of head can affect the drainage of blood from sinuses. Change in head position may influence the flow dynamics within the cavernous sinus. Now let us discuss the clinical anatomy of the cavernous sinus. The thrombosis of cavernous sinus can occur due to the sepsis in the dangerous area of face. So here the patient can see is a severe pain in the eye, forehead, in the distribution of ophthalmic vein, involvement of oculomotor, trochlear, and sixth cranial nerve that can result in paralysis of muscle. So there would be edema of the eyelid, cornea, etc. Apart from that, there would be exophthalmos. In some cases, head injury can cause a communication between the cavernous sinus and the internal carotid artery. So this is known as a pulsating exophthalmos. So the communication that will allow the arterial blood to enter the sinus, causing the eye to protrude and pulsate with each heartbeat. So this phenomenon is characterized by visible pulsation of eyeball that is synchronous with the each heartbeat. Coming to next is the superior sagittal sinus. So this one is the superior sagittal sinus. So it occupies the upper convex attached margin of the falx cerebri. So it begins at the crista galli by union of the tiny meningeal veins. So as the sinus run upward backward, it becomes larger in size. So remember, it's triangular in shape and it ends near the internal occipital protuberance by turning on one side, usually the right, and become continuous with the right transverse sinus. The interior of sinus shows the opening of superior cerebral vein, opening of venous lacuna, rachnoid villi, etc. The tributaries, these are the tributaries: superior cerebral vein, parietal emissary veins, and the venous lacunae. The next is the straight sinus. The straight sinus, this one is the straight sinus. Remember, the straight sinus line in Vedian plane with the junction of the falx cerebri and the tentorium cerebri. So it lies at the junction of falx cerebri and tentorium cerebelli, and it is formed by the union of inferior sagittal sinus, with the great cerebral vein. So both the inferior sagittal sinus and this great sagittal sinus unite to form straight sinus, and they ends at the internal occipital protuberance as a continuous of the transverse sinus. So similar, the easy mnemonic is straight. It starts with the superior sagittal sinus, then turns to the transverse sinus, or right confluence of sinus joins the flow, rachnoid inferior sagittal sinus, and combines with the great vein of Galen. So these are the mnemonic. The mnemonic is straight. The next is the transverse sinus. Transverse sinus, they are the large sinus located at the posterior part of the attached membrane of the tentorium cerebelli. So the right transverse sinus, it is a continuation of superior sagittal sinus. So its tributaries are, remember, the mnemonic is snake ingest delicious insect. S stands for superior petrosal sinus. I stands for inferior cerebral veins. D is diploic veins, and insect is inferior cerebellar veins or inferior anastomotic veins. Remember that for your exam point of view. The next is the sigmoid sinus. It is continuation of the transverse sinus, and it is, remember, the shape is F shaped. So it extends posterior inferior of the parietal bone to the posterior part of the jugular foramen, where it becomes the superior bulb of internal jugular vein. The mnemonic to remember is mice. M stands for mastoid and condylar region. I is internal auditory vein, C cerebellar vein, and E is the emissary vein.